Hello again. So today I'm going to talk a little bit about what's different between the SOOF Lift Blepharoplasty that I published in 2000 and teach around the country up until present day, and what other doctors do, or some I should say, because a lot of doctors have adopted my technique. So it's not a short answer, unfortunately, but I can keep it simple. In the old days, and unfortunately there's still some guys that do this, doctors made an incision on the outside, lifted the skin and muscle, and either remove fat from the lower lid, actually that's what they did in the old days, and then lifted the skin and muscle to try to tighten the lower lid. And that just made people look more hollow because they didn't do anything to the mid-face, no mid-face lifting. And just taking fat out of here made the hollowness even look worse. And even more of a problem was as they healed, they tend to get this rounded look to their lower lid, what we call scleral show, where you can see the white part of their eye underneath the pupil, and that doesn't look good either. So that's progressed up to maybe the last 5 to 10 years. The doctors that finally realized that taking fat out of the eye was not good. Some of them tried doing fat grafts from the other parts of the body to the lower mid-face right here where the hollowness is. Again, over time it was shown that that just isn't very helpful because you get clumping sometimes it's overdone, sometimes it looks okay for a while but then it resorbs, so it's not predictable. So why are you doing something that you can't predict the result from, or what it's going to be? So then guys who failed to learn how to do the SOOF lift because they thought it was maybe too hard, too technical, I don't know, decided, well, I guess fat grafting doesn't work. So that in about maybe about the same time when they finally realized the grafting wasn't work, they decided to just take the fat that they used to just take out and throw away and transpose it from the lower lid down to here to fill in that void that occurs with aging. So that's actually a little better than fat grafting, but it still doesn't solve the problem. And a lot of the patients, the graft, when you move from here to here, the blood supply is attenuated. A lot of times it just doesn't take, shrivels up. You're still unnecessarily hollowing out the eye because this fat is there to keep your orbit in place. So if you take out too much and try to put it down here, the orbit retracts a little bit, and this hollowness that we're trying to improve doesn't improve because the puffiness right here that we're trying to improve doesn't improve because the eye looks retracted. Just doesn't look natural. So the fat grafting or transposition of fat doesn't really work very well. So what I do that's different, what I've done since before 2000, is I figured out that age in the lower lid is a fat malposition problem. The puffiness here is due to the orbital fat getting in front of the eye. The hollowness is due to the SOOF migrating down to here, as it has in me. Too bad I can't do it to myself. So the SOOF lift takes the orbital fat, tucks it back behind the eye, takes the SOOF fat, lifts it up to here, which is where it was, by the way, when you were a teenager. And the end result is a very natural looking lower lid that lasts a long time with very little complications. The most common complication I have is what's called trichiasis, which is just an eyelash, one of these lower lid lashes growing towards your eye rather than away from your eye, and you pluck it out until it goes away. And that's less than 1%. So the SOOF lift procedure is more predictable, longer lasting, looks more natural, safer. You just have to find a doctor that knows how to do it. And obviously that's why I get people from cross the ocean at times to come here because I'm the one that started that procedure. So I'll show you some examples of how powerful that lift is with some patients that only had a SOOF lift in the photos that follow. All right, here are some patient examples. This first one is a 47-year-old female, 6 months post-op from a SOOF in CO2 resurfacing eyes and mouth. You can see the marked improvement in her midface. She had nothing done to lift her midface other than the SOOF lift, and the marked improvement in the puffiness and hollowness just from that procedure alone. The next patient is a 47-year-old female, similarly 6 months post-op. She had a SOOF lift, which is what helped her midface. She did have a signature lift, but that only lifts along the jawline and neck, does not lift the midface. And she had an upper lid bleph with no CO2 resurfacing. But again, just the SOOF lift is what improved her midface, and obviously the puffiness and the hollowness is what that procedure treats the best. This patient is 57 years old, 8 months post-op. She had a SOOF lift, a Endoscopic Segmental Brow Lift Category 3, which is another lecture of mine, and CO2 eyes and mouth, same thing. Improvement in the midface, nothing done to the midface other than the SOOF lift, which made her puffy, hollow area much better. Looks very natural, and we now know is very long-lasting. This is a 56-year-old female, again 6 months post-op. SOOF lift with CO2 of eyes and mouth, and I guess I sound like a broken record, but it's a nice record. The midface looks good with nothing done but the SOOF lift to help the puffiness and hollowness. No deep plane lifts, nothing other than that great procedure, the SOOF Lift Blepharoplasty. And our final patient is a 54-year-old who had a SOOF lift, CO2 eyes and mouth. She is 6 months post-op. Very strong example of how this helps the midface. Obviously, by that I mean the puffiness and hollowness, and how natural those results look. And it's very powerful, just that one single procedure.